Thank you very much. Great to be here. So Dr. Peters Center, we were involved at least 2, maybe 3 of the studies that were represented tonight. We're a frontline organization, and we do some of our own research, but mainly work with others. I included on here our values. When you think about anything that we do, it's 100% values-based, and that's where we have to start every time. What I'm talking to you today is not about the programs we do specifically, but more about what it looked like over the last little bit. I'm going to start with, we've started to define who we work with, and this is part of the problem in Canada. We don't have great language to talk about the archetype of the human being that we work with. So there's about 2% of the population that is sidelined from all health services, housing. These are people that have mental illness, they've got concurrent disorders and complex medical needs. So if we go back, we're looking at SCSs, how they ramped up over the years. We have to go way back to 2003. There was 2 of us, and most of you have probably heard of Insight. They were the first supervised consumption site in Canada with legal federal exemption. Our little claim to fame is that we were open a few months before them, but we did not have legal federal exemption for about 14 years, I think it was, much later. But we were able to open under a loophole in the Nursing Act from our province. So if we look at the headlines that were happening back in those times, so the headlines back in 2003, it's about controversy, it's about legal challenges, it's hurdles, it's opposition, lots of judgment, criminalization, wasn't about health care. And the drug of choice, this is important because the drug of choice was heroin, cocaine by injection. And there was always a death toll, that's why we opened them, but it wasn't huge. So if we look over the years, this is 2021, so from 2003 to about 2000, I think it was 17, nothing happened. Like there was no others that grew. And then all of a sudden we had this explosion. COVID actually had a lot to do with this. And at the Dr. Peters Center, we worked with a lot of these to help look at them with policies, helping them with policies, procedures, and actually help set up numerous of them. You'll see SCS, OPS, and other. That's just different classifications. Some have legal exemptions, some didn't. But the bottom line, they were all there to help people use drugs. So you can see the headlines here are very different. The headlines are compassionate, they're very positive. The headlines are data-driven. And that was the same with the public reality. There was a lot of compassion. The drug overdose crossed into the mainstream. It wasn't, quote, junkies anymore, it was newscast people. It was your suburban couple that were dying. And so all of a sudden it was a very different public sentiment. The drug of choice was starting to change, especially those with daily users, and it was now fentanyl, mainly by injection, that was becoming the drug of choice. And also we were starting to see a little bit of inhalation. Safe supply had started, we've talked about that. And also IOT, so intravenous opioid agonist therapies, and we started an IOT program with diacetylmorphine. We started with hydromorphone, nobody wanted intravenous hydromorphone, but we went to diacetylmorphine. There was a lot more funding, and there was a lot of frontline engagement. The stat in those days was about 1 death every hour across the country. Fast forward, so we look at today, you can see it going down. The headlines are very different again. You see it's all about confrontation. It's about, we did decrim, now we've done recrim. There's still an hour every day. And so there's 1 overdose every day. So even with all the work that we've done, we're still at a very close, piece of the deaths that are happening. And you can see we're back into the judgmental rhetoric, and these people themselves are blamed. People just don't want to see them anymore. It's not a matter of compassion. And the drug of choice is fentanyl plus benzos. We talk, there's a lot of different ways of saying it. We say contaminated. And it's inhalation. So you can see where are we going with SCSs in Canada. It's going down, it's going the wrong way. What does that mean? It means that the 2% are, that those ones that are marginalized are not going to remain the 2% for very long. That's actually growing, not going down. This is just to consider, not going to talk about it, and I'm done. So this is just my province, but there you go. Thank you.